of the Board of County Commissioners to order on Tuesday, March 13th, 6:01 p.m. I would ask that Commissioner Goddard do the invocation and Commissioner Rawls does a pledge of allegiance. All stand if you can.
If you don't mind. Lord, thank you so much for allowing us to be here. Lord, help us make good decisions. We understand that these things are tough decisions, but they involve a lot of people, Lord, and we just ask that you be with us, you help us, and you guide us. We ask these things in Jesus' name. Amen.
Amen. Will you join in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Goddard, Commissioner Rawls, for that.
Mr. Chairman, before we get started, just for clarification, would you please read the date and the day of the week again? I believe you might have said Tuesday out of habit.
It
Friday.
says Tuesday up
Oh.
here. Yep.
That's our fault, then.
Okay.
I am so sorry.
I read it like yes,
You did great.
it's Friday, March 13th.
I failed.
At 6:01 p.m.
Thank you.
Sorry. Hey, we're in an emergency meeting.
Otherwise
and
known as
things
Friday
are
the
moving
13th.
fast. I do want to call Mary Garcia up, if you don't mind, our Health Department Specialist for the county, and all things health-related. And Mary, if you'll give us an update of everything that's going on, or as much as you know, put it that way.
I'd be happy to. I think for the state of Florida, things changing dramatically. As some of you probably have received press releases from me at all hours of the morning. We're trying to keep you as informed as we can of the changes that occur on the state level because that affects each of us. If a county next to us has cases, it is one of those things that we want you to keep you informed, to keep our citizens informed, because this is a virus that spreads pretty fast. It's very contagious. And since there is no cure for it today, we want to make sure that we do whatever we can to mitigate the spread. Eventually it will come, but we want to make sure it doesn't impact our county as much as it has impacted other countries. So that's why we're here.
Ms. Garcia, if you could, for the public's knowledge, what could they do to protect themselves right now? What's the main things that they can do?
The most important thing that individuals can do is, the guidelines, this is guidance from the CDC and guidance from the state of Florida Department of Health. So if you are ill, if you have, can I go get my cheat sheet? Because I
Yes,
haven't
please.
had great memory.
Please. I didn't mean to put you on the spot, but this is changing very
I
fast.
can
so-
still talk, but you know,
Yeah.
bad at this. So, this is something that we share every day. So if you are experiencing any symptoms of fever, illness, respiratory illness, in particular, lower chest, that you're ill, those are those cases that we're going to look at. There's an algorithm that we work on and are working with our medical facilities, working with our medical directors. It's the incident and commander for that is our epidemiologist, Kenna Foster. But those are those items. If you have traveled to a foreign country, if you traveled internationally, especially a country that is now at a level 2 or 3, those items we want to review as you come into the country. But locally, what you can do is really, like I tell everybody else, and people have heard this from me so much, they're probably tired of it, but you want to make sure that you exercise due caution. So avoid close contact with individuals that are sick. That's the flu right now. It could be my allergies. Staying home if you're sick and avoiding contact with other individuals. So if you're in poor health, your grandmother's in poor health, make sure that you don't expose them to yourself if you're sick. You avoid touching your eyes and your mouth with unwashed hands. So the most important thing is soap and water. You can sing happy birthday to yourself, so that adds up to about 20 seconds. And that's singing happy birthday twice to make sure you do that. Wash your hands often, especially if you're going to the bathroom, before eating, before blowing your nose, sneezing, before and after. Just common sense. If you do not have soap and water readily available, then you want to use a hand sanitizer. There are rules that you want to say it's probably about 60% or more alcohol, just to be certain, because you want to make sure, but always wash your hands if they're dirty. But what is important about this is that also any surface that you might have inadvertently sneezed on or coughed on might also be a vector. So you want to make sure that you also sanitize those. So wipe things down, make sure that you are trying to keep yourself as free from any kind of, whether it's flu or coronaviruses as possible.
Good, thank you. Commissioners, any questions from?
No, I'm good.
All right, good. Thank you very much
Very
for that
welcome.
information. I did reach out to Colonel Wells and Sheriff Deloach before this meeting. Commissioner DeRizzo from down in DeSoto County said they were using their electronic billboards to put out to tell people to wash their hands, take care of themselves, the same things you were just saying. So we'll see where that goes at, so.
I do have a question that does not relate to what we were just talking about, but as far as our local hospital and their preparedness, can you speak to that at all?
Yes, and in fact, we met at the hospital yesterday. We actually met with, tried to do a conference call with all local physicians so that they're also aware of some of the guidelines. One of the things that we want to ensure is that we don't overtask our emergency room. So one of the things that we're trying to make sure that we do is we use the community as a whole as an education, and also to be able to make sure that if you are a doctor and one of your patients calls you, that you try to triage those calls before they come into your office. Just to confirm, it's scary. You watch those red dots across the globe, and guess what? It's a little scary.
Yeah.
Why? Because we just haven't had this before. I'm sure before the flu came into existence and when it came to being, we probably were just as scared back in those days. That's why they call it a pandemic, because we haven't developed immunity to those items. So that they're well aware. They know, actually, I think most of the incidents and talking to them has gone up is mostly based on the flu right now, but it's that time of year for us in Putnam County. One of the things that we do want to warn everybody about is that Putnam County always does have the most cases or the highest tick on the flu. I, of course, attribute it to that we've got really good partnerships that people report,
Right.
where they might not be reporting other places. So that's the good and the bad about being a good partnership and people reporting those individual cases and testing. So, you have both sides of the story on that.
We also have seasonal residents and I'm sure we still have a lot of them
Yes, sir.
staying here. So it's, and a lot of those, are going to be the vulnerable ones if, and then the other question is, with regards to ventilators in Putnam County, any idea if we're stocked very well, or?
Yes, I can share that we have ventilators at the hospital, and because of their agreement with HCA, they are able to they already have agreements in place if something were to happen, where those would be received in Putnam County.
Thank you.
Thank you.
No problem.
Thank you very much. Okay, Commissioners, I'm going to ask
Glad to.
Commissioner Goddard, do you want to read the proclamation?
I will. Proclamation of Local Emergency Executive Order COVID-19, March 13th, 2020, Proclamation number 2020-30. Whereas coronavirus disease 2019, or COVID-19, is a severe acute respiratory illness that appears to occur through respiratory transmission and presents with symptoms similar to those of influenza. And whereas on January 30th, 2020, the World Health Organization declared a public health emergency of international concern related to COVID-19. And whereas on January 31st, 2020, the United States Department of Health and Human Services declared that a public health emergency exists nationwide as a result of confirmed cases of COVID-19 in the United States. Whereas, as of February 29th, 2020, COVID-19 has spread throughout China and to 67 other countries and territories, including 62 cases within the United States of America. And whereas the Centers for Disease Control and Prevention recommends that all states and territories implement aggressive measures to slow and contain transmission of COVID-19 in the United States of America, and whereas on March 2nd, 2020, Governor Ron DeSantis issued Executive Order 20-51, the terms of which are incorporated herein, declaring that appropriate measures to control the spread of COVID-19 in the state of Florida are necessary, and therefore directed that a public health emergency be declared in the state of Florida, and whereas on March 2nd, 2020, the state Surgeon General and state health officer, by virtue of the Governor's Executive Order 20-51 and Section 381.00315 of Florida statutes, issued a declaration of public health emergency declaring that a public health emergency exists in the state of Florida. And whereas on March 7th, 2020, Governor Ron DeSantis directed the Director of the Division of Emergency Management to activate the State Emergency Operations Center to Level 2 to provide coordination and response to the COVID-19 emergency. And whereas on March 9th, 2020, Governor Ron DeSantis issued Executive Order Number 20-52, declaring a state of emergency for the state of Florida to address the public health emergency caused by the threat of COVID-19 to the state. And whereas, as of March 13th, 2020, 27 individuals in the state of Florida have tested positive for COVID-19. And whereas, as of March 13th, 2020, 18 counties in Florida have positive cases for COVID-19, and COVID-19 poses a risk to the entire state of Florida. And whereas COVID-19 is a threat to the public health of Putnam County residents, workers, and visitors. And whereas Section 252.38 Florida statutes states that safeguarding the life and property of the county's citizens is an innate responsibility of the governing body of each political subdivision of the state, and further grants to the county the power to provide for the health and safety of persons and property, and to waive the procedures and formalities otherwise required of the county pertaining to taking whatever prudent action is necessary to ensure the health, safety, and welfare of the community. And whereas, in order to be in a position to provide the most effective assistance to the citizens of Putnam County and the state of Florida for the duration of the declared public health emergency, it is necessary that a declaration of local emergency be declared as of 6 p.m. on March 13th, 2020, to remain in effect until 6 p.m. March 20th, 2020, 7 days, unless extended prior to that time for an additional 7 days. Now therefore, pursuant to the authority granted by Sections 252.31 through 252.62 Florida statutes, the county's home rule powers, and Putnam County's comprehensive emergency management plan, a declaration of local emergency is declared as of 6 p.m. on March 13th, 2020, and shall remain in effect through 6 p.m. on March 20th, 2020, 7 days, unless extended prior to that time by the Putnam County Board of County Commissioners for an additional 7 days. 2, the Putnam County Comprehensive Emergency Management Plan is activated, and the utilization of the emergency powers under Sections 252.31 through 252.62 Florida statutes is authorized. This executive order shall be applicable throughout the unincorporated areas of Putnam County, Florida, and through the territorial boundaries of any municipality located within Putnam County, Florida, but only to the extent that it does not expressly supersede or otherwise conflict with any municipal ordinance or regulation. Dated this 13th day, March 2020, in Palatka, Florida, effective at 6 p.m. on March 2020. Chairman, I request that we move ahead with this executive order.
Second.
Proper motion by Commissioner Goddard, proper second by Commissioner Rawls. Any other discussion? Hearing none, all in.
I do have a
Oh, you
question.
have-
So, if and when we pass this, what will be the immediate effect? What does this allow our county staff to do or not do for the citizens' edification?
Mr. Suggs, you want to take that?
I would, Quinn, would you like to come up and explain what the process is and why we actually go through the process of approving a local state of emergency as it benefits the citizens of Putnam County?
Mr. Simpson also, thank you.
And Mr. Simpson, so thank you.
Sure, thank you. In essence, what we're wanting to do, and the reason we're here tonight is we've been taking many, many extraordinary preparedness measures for the last 5 or 6 weeks. We're at the point where we're going to need to start taking additional measures, such as opening call centers, moving staff, providing additional resources to the EOC or to help the Department of Health. And moving those things, you're talking disrupting departments and some of the daily normal functions of what we do on a day-to-day basis. We also are going to be looking at, a variety of ways to mitigate any continued exposure or cross-contamination, things of that nature. So, as I said, one instance, and I'll share, about a week and a half, 2 weeks ago, we started with the 911 center asking questions so that when we were sending EMS out and fire rescue, we were ensuring that they were, knew the call was something to be not necessarily suspicious, but most of them are flu-type symptoms, things like that. But I wanted to make sure all of our folks, when they got there, were ready, had all their PPE on and things like that. So taking those measures and continuing to be able to move forward and meet this is change. We've had 4 or 5 changes today. So, I mean, it's an evolving process. And as y'all have seen over what the governor, President Trump today at 3 o'clock issued, or 3:30 issued national emergency. That hadn't been done, in the past. So this also helps us with recouping costs and tracking and those kind of things.
That was one of my questions. Are we activating the ESC?
At this time, to best support the Department of Health, it's our intent to stand up certain elements that would basically allow for us to respond to the public as they may call the EOC for information. And stay tuned for more information next week as to how we can best respond to resident questions and concerns.
So is that a yes?
If need be, right? If need be.
I'm just trying to get a feel. Are we gonna activate the EOC? Are we gonna start bringing staff in for that?
There's no sense of activating the EOC where you see 80
Okay.
people in there. I don't anticipate that.
Okay.
But where we're at is activating the call center so that we're able to immediately, if somebody has a question, we're able to take that load off the 911 center and the sheriff's office, because they're getting calls, the health department's getting calls. So we're gonna have health professionals in the EOC at the call center,
But at this time, we're not gonna shut the government down. We're not gonna, okay, reassign, because you said moving staff around, and so that just brought the question up.
The moving staff was, helping at the call center, or helping,
Right.
Different functions, not necessarily, the full scale. Am I saying we'll never get there? No, because obviously this is, as this,
Right.
we'll scale it as we need it to.
We got, I guess one good thing we have going for us is spring break starts next week. Is the school district having any conversations? Because I've heard some school districts potentially are looking at ending the school year early.
I believe as of this afternoon, the executive order will sit down that all schools will be closed in the state of Florida beginning Monday for the next 2 weeks.
I can comment on that.
Extended that.
Department of Education issued that.
Mr. Rawls? Mr. Cutter?
And those are things, there's different things we'll have to respond to or work on should things come up of that nature.
So what we're going to do is we're going to go ahead and activate the call center at the EOC. We'll have a couple folks from probably the health department and then a couple of employees from the county man that right now. I believe it's going to be Monday through Friday, 8 to 5, unless we see there's a high call volume, then we'll be more aggressive on that. But this gives us an opportunity to start tracking all the calls and the hours associated with that and move forward.
All right, Mr. Goddard?
Well, that's what while you were up there, and maybe Miss Mary can answer this too, is the kids are going to be out They'll be out for this week, and it wouldn't surprise me for them to extend the spring break because of this situation, which also falls into the fair, which will be starting next Friday. And as far as I know at this point, it's not being shut down for any reason.
They shut it down?
I think they,
Oh, wow.
I just got a sign that they decided
Okay.
to make some changes to it. I'm sure with the governor's 1,000 people at the event that had,
Well, that's.
We've been, like I alluded to, we've been working on this situation for the since late January, early February in earnest, planning for, this is something that's uncharted territory for everybody.
sure.
I've been doing this for a very long time, and, you know, we've never had something of this nature, so, through Ms. Foster is our incident commander. She's with the Department of Health, along with Mary. But we've had planning meetings. We've had strategic.
It's been a
Yeah,
long
we've
day.
had that too. It's been a long day.
Friday night.
We've had a number of, planning and things. We've got a whole lot of things planned for. Hopefully, we will never use some of them. But if we need to, we're ready.
We're ready.
And one of the things we've been working with, you asked the question about the hospital. We've been working with the hospital. We are fortunate, much more fortunate than some other counties, Dixie, some of these others that don't have a hospital. So the patients that you're gonna see, there's no treatment as far as cure. You can't give them Tamiflu, all those kind of things. So, we've been working on a variety of issues to ensure that the folks that need to be in the hospital are at the hospital. The folks that we can assist at home, are at home, and a number of things of that nature. You wanna
So community-wide things that we started yesterday is we have weekly conference calls with all physicians in the county. That's an ongoing call that they have invites to. We have weekly calls with the office managers so they can help work through systems, what problems are they running into, and then weekly calls with all long-term care and ALF facilities and group homes so that we can make sure that they're prepared.
Good, thank you. Okay, gentlemen, we have a.
Well, and also if you would like, just so for more information, we've already went ahead and some of the youth events, we went ahead and canceled some of the youth events to go along with the school closures, and so we've done that. And also, I believe Judge Zambrano has sent out a directive where they're going to be modifying and limiting a court for the next couple of weeks, I believe it is.
Correct. They're going to follow the State Department of Education. Judge Zambrano has announced the cancellation of civil, criminal, and jury trial court proceedings until March 27th, which is exactly what the State Department of Education has done, and we followed suit as well.
Okay, I want to get back to that, but right now we have a vote on the floor, so all in favor signify by saying aye.
Aye.
And opposed, like sign, the ayes have it. I'm sure our PIO officers will be posting as much information as we can get. Thank you all very much. Quinn, go ahead.
One thing, we have stood up the JIC, the Joint Information Center, and Mary and all of the PIOs have been meeting, and we'll come out with a common message and move forward so that we can ensure that the public has the right information, not
Right.
necessarily what may be posted on social
And to remain calm.
Exactly.
The county is sufficiently able to handle this, and we're moving forward right now, and we're prepared, and no stones not unturned, so we're ready to go forward with that. But be calm and pray for our community, and I think that's the important thing. I do want to ask if there's anybody from the public that would like to speak before we close the meeting. Okay, there's nobody from the public. I do want to thank our staff, Mr. Suggs. I want to thank you for staying in touch with me today and making these decisions to call this meeting to order and for us to be able to have this meeting and start this declaration. And that gives powers available to you and staff to do the job that you need to do. And we do thank you for that. And if there's no further business coming before the board, we'll adjourn the meeting. Thank you.